the main reason for not meeting is to slow down the rate by which one person passes on the infection to others.
Yeah.
And part of that is that the infection travels a little unknown in the community, and although the official numbers are quite low, I believe today on Sunday we're at roughly 200 cases in Australia total and 57 in Victoria. That seems like pretty low numbers. 1 in 100,000 has a chance of finding somebody with a positive result. But the actual number of people who are really infected is actually, they are unknown. And they're kind of hidden.
That's right,
until they have an official test result,
Yeah.
which can often be a delay of 7, 10, maybe 2 weeks before they actually know that they have the infection. And so that's actually illustrated in this graph here. This is the timeline in China, in the province that got the infections.
Right, okay.
And the orange bar is actually the official results. This is when the official test results came up. And what they can work back from when the patient was identified as having the infection is not the time when they actually began to have the infection. And so if they work that back, they end up with the blue chart there, which shows that actually at these very low numbers of official results, the actual numbers are much, much greater. So in Australia today, or in Victoria today, 57 cases translates to about 1,500 cases that of people who don't know they have the infection. And unfortunately all those people are out there somewhere, living their lives normally and carrying on.
Could be one of us in the congregation.
You and I inadvertently passing on infection to everyone else. So not meeting together actually is slowing down the possibility of transferring the virus from one person to the next person to the next person after that. And that is a lesson that is more than 100 years old. It's a lesson that was learned the hard way in the 1918 flu epidemic, when there were some cities that closed down very early before they had large numbers of infection, and there were some that were more reactive and closed down their schools and their community visiting, their churches, only after they started to see a large rise in infections. And that's shown in this graph that looked at some US cities. And down the bottom are cities like St. Louis that were very, very early. They were a couple days before the day zero when the infection rate started to rise, and they closed their schools and their hospitals and their churches, and they ended up with a huge reduction in the deaths in that city compared to cities like Pittsburgh up the top there, or Philadelphia is another that actually didn't close until it was really obvious they needed to, when they already had children getting infected in school and those sort of problems. So you can say they were about day 7 after the 0 point, and their results were much, much poorer. So that's the importance of being early and shutting down before the infection has a chance to take hold in the community.
So you think it's wise to do that even before government officially?
Well, the government, the politicians who sit there are trying to make these difficult decisions, and they're often caught in feeling like maybe they shouldn't act too early, that they'd be blamed for shutting down, for causing great economic harm. And you can hear that in some of their statements of worry about being too harsh too early, about perhaps it would be bad to have all of the kids at home running amok, being looked after by grandma and grandpa, and they're worried about the social and economic impacts. But unfortunately, this is a situation where you really can't negotiate with the virus. and it's going to spread, and it does spread quite well in these sort of areas, in contact in schools and in churches. So that's the learnings from the 1918 flu epidemic. This is Philadelphia versus St. Louis, and you can see the flatter curve of St. Louis. And that's you'll hear some politicians speaking about flattening the curve. That's where they're talking about we need to spread out how quickly people get this. I've heard some people say, we're going to get it anyway. Why not just get it now and get it over with?
Get immune.
Get immune early. And just get on with it. But in fact, that means all of us getting infected all at once creates a great flood of cases. And that's where the hospitals come in. That if we have that happen, we will flood our emergency departments and our hospitals with too many patients. And that's what the Italians are having to struggle with now, that they have far too many patients. And if we spread out when people get the infection, yes, it's true, it'll make it long. It may make it many months before somebody gets infected. But if it's slow, then we will have enough capacity in our hospitals to deal with it, and everybody will get treatment. So it is true, and this is where the reassuring bit, that a vast majority of people will get this infection and will get over it like it was just the flu. This graph shows 81% got over it with fairly mild symptoms, didn't need to go to hospital, didn't need to go anywhere for that. It is the worry that there's quite a number that require hospital, 13%, and 4% that required intensive care, like breathing tubes and those sort of things. Our elderly population is going to be the most at risk here, and I think a community like our church with lots of folks who are over 65 and many years older than that, we really need to help protect you all from a very serious infection.
Sure. Now, there's also people saying that it's affects more of the senior folks and not the children and young people. Why do you think it's still good to stop some of the program for kids or close schools?
Right. So it is unknown why it is so mild in kids, and in fact actually really hard to even prove infection in kids. But schools are a place where the virus can be spread and mixed and then returned to homes where there are more vulnerable people, older people, grandparents especially. And so they're a mixing place both for kids, but they're also a mixing place for adults as well. And so there's I think fairly strong evidence that schools are a place where this does spread. So they become part of it, even though they're probably going to have extremely mild disease and not get very sick.
Sure. Thanks for the conversations, and I hope this has helped all of us to consider the vulnerability of this particular time, and that we can understand the need to make some drastic decisions for the safety and health of the well-being of the whole community.
So I think we're going to have to work out some creative ways of doing church, of being church in this time, and of looking after each other in many ways. It's so much better than it was in 1918. That our communication and ability to stay in touch with each other is so much better than it was. We can be all at home on our phones and on our internet and still meeting with each other and encouraging each other and keeping each other well. So stay well and stay home.
And stay tuned for more info and updates, and probably get Michael back if things develop.